hat because I'm cold. It's like, I don't know, like 50 here tonight, which is nice. No heat on, no stupid fans on upstairs that I can't control, no stupid dehumidifier on downstairs that I'm not allowed to control because I must be too stupid.
Oh, and they got it on air conditioning. Let me take a picture of that.
But anyway, back to Behçet's. Talking about the 15% or so of Behçet's patients who have at least eye involvement and possibly CNS involvement or vascular involvement. The first option for treatment is interferon A, which is very expensive as far as I know. I do not think there are any FDA approved medications for Behçet's on its own yet. Let me know if there are now. Like I said, I've been dealing with this forever and kind of wriggling around with insurance and whatnot. But so you've got interferon and then the TNF alpha, which is tumor necrosis factor alpha blockers. And there are, I believe, 2 studies, and now I think there's a third one out from NYU. Anyway, the first one is etanercept, which basically shows that it's fairly effective for Behçet's disease. The other one, which I take, is infliximab or Remicade, and I have been taking that for, probably about 3 years now. I tried Humira for a while. It wasn't working. I tried Enbrel. I was so allergic to it. I went back to Humira. Didn't work. I did Remicade, had the infiltration, had to stop Remicade, went back to Humira, which didn't work, threw me right back into severe Behçet's flare, and I've been back on Remicade every 4 and max 5 weeks since. So Remicade works very well in the control of eye disease with Behçet's. The other choice is thalidomide. That works especially well for severe oral ulcers. But as you know from the thalidomide babies, it is highly teratogenic. So you have to be very careful with thalidomide. And it can be just very toxic on its own. A lot of side effects, I've heard. But they use very low doses, I believe under 15 milligrams for Behçet's patients. But I know for me personally, that is always an option on the table that I have if I need it. So, and then in addition to the interferon, TNF-A blockers, thalidomide, of course, ye good old steroids. And this is for severe manifestations, of course. I know every time I've had a bad flare, I go to the hospital, they hook me up with an IV, and it's 180 milligrams IV prednisone a day, which I believe is the maximum you can get. But it has saved my eyes, it has saved my brain sometimes, it has saved my joints, meaning I was in such bad pain I could not tolerate it. On the other hand, I have developed Cushing's, which is going down, and adrenal insufficiency from being on such high doses of steroids for such a long period of time. But I mean, I know it's a strange combination, Cushing's and adrenal insufficiency, but it is slowly starting to taper off as I'm slowly tapering off the prednisone. It's been over a year for me to get from 12.5 milligrams of prednisone down to 1.5 milligrams of prednisone. Low dose steroids is really not proven to be effective for Behçet, except for some of the skin problems, as I mentioned before. It's like with even a tiny bit of prednisone, my face totally clears up. Not that I've got like acne galore, but you know, all the Behçet's like stuff, it does more or less go away with even just that little bit of prednisone. On the other hand, high dose prednisone often gets large vessel involvement and or eye disease under control well and very rapidly. But it can only, as I just mentioned, be used for brief periods of time without causing severe problems. And the Cushing's and adrenal problems are really kind of on the low end of the severe problems it can cause. I mean, I know it can cause all kinds of osteoporosis. Actually, it also has affected my teeth. I went from having literally 0 cavities to I don't even know how many fillings I have had in my mouth now from my teeth literally disintegrating from the prednisone. Probably somewhere in the range of 30 fillings, which is ridiculous. And I also had a root canal in this front tooth. Yeah, great, right? Front tooth, root canal, which actually caused me incredible pain until just a few months ago. And that was about 2 years long that I was just in agonizing pain from this root canal, which they're not really sure if it was actually an affected tooth or if it was just inflammation and vascular problems. Because when the oral surgeon went in, just behind my tooth up into drill, it bled for a solid 45 minutes. And this oral surgeon, she said she's been doing this for like 35 years. And It was the first time she had ever seen one tooth bleed so much for so long. So that is my prednisone mouth story in short. I also want to talk about colchicine. As I had mentioned earlier, there have been studies that colchicine is actually not very effective for most manifestations of Behçet's. The main indications of colchicine are actually for arthritis, the arthritic involvement, some skin lesions, if they're true skin lesions and not thrombophlebitis, and genital ulcers only in females. With any vascular problems with the deep vein thrombosis and thrombophlebitis, it is not recommended for Behçet's patients to be on anticoagulant drugs like heparin or other oral anticoagulant drugs, because basically it is not a problem due to the coagulation cascade per se, but more about the inflammation actually in the vessel wall. These also should be treated with anti-inflammatory immunosuppressives, azathioprine, interferon, and TNF alpha blockers. For the arthritis part of Behçet's, they often use NSAIDs, which I cannot take. When I first started with the severe arthritis with Behçet's, that was other than the hardcore pain meds. They put me on hardcore NSAIDs, indomethacin and piroxicam, both of which worked extraordinarily well in controlling my pain and reducing, I suppose, the inflammation in my joints, and it also felt like bone swelling, bone pain. The problem was, with both, I also started with the internal bleeding. Eventually, I once again tried Motrin, thinking, okay, this is an NSAID. It will work as an anti-inflammatory, but it is less potent than these other stronger NSAIDs I've taken. Ended up in the hospital with literally a stomach full of dried blood when they did the endoscopy. So I cannot take NSAIDs. Also with the NSAIDs for arthritic symptoms with Behçet's, the recommended medication is sulfasalazine. I don't know if you have seen those little posters on Instagram or Twitter or a Facebook group or something like this where they say Behçet's is like having lupus, multiple sclerosis, rheumatoid arthritis, and Crohn's disease all in one disease. And that's really kind of true. Other than in the long run, your chances of remission are higher. So Behçet's is basically a distinctive multi-system vasculitis which affects the large and small vessels, the arteries, and the veins. Basically, it is Wherever there is blood flow, Behçet's can affect it. I've read also on the Behçet's Disease Association, I believe, website, that HLA-B51 testing is not recommended in this country because that association is in the Middle East and it doesn't apply over here. But I have it. I don't look Middle Eastern at all. I mean, I guess if you know your exact lineage, maybe it's a different story, but I would never go so far as to say it's irrelevant, don't have it done, because I think it's important to know. And I would say if you can possibly, I would get your HLA-B27 because, you know, maybe it is ankylosing spondylitis, especially if it feels like arthritic pain, bone pain. Plus, that can present with other Behçet's-like symptoms. I would suggest so the HLA-B27, HLA-B51, and the HLA-DRB1 asterisk 04. So basically, Behçet's is diagnosed clinically, which means that you have to present with certain symptoms that follow the clinical guidelines. And if you meet these, I think, kind of criteria, then they'll say you have Behçet's. Dr. Yazıcı. The International Study Group criteria for diagnosis of Behçet's is 3 times in 12 months or more. Oral ulcers, 1. That's a must-have. Plus 2 or more of the following, and there are 4. 1. Genital ulcers. 2. Eye lesions. 3. Skin lesions. And 4. A positive pathogy test. Which is interesting because I have a positive pathogy test when I'm not on super high steroids, right? But I know there's a lot of people, especially in the West, that do not ever have positive pathogy test results. And some of these people have had very severe Behçet's manifestations. So I think maybe these criteria need to be, I don't know. And it seems kind of like almost you could throw these criteria at a lot of people with chronic disease and it would stick. And I do feel like they're kind of either over-diagnosing Behçet's, or 2, which I think is probably more probable, that Behçet's, being such an old disease, has kind of branched off, right? Which makes sense if there are now 2 known genetic associations. I don't know, it's just interesting because the severity of the disease is still the most severe in the typical Middle Eastern Turkish young male Behçet's patient. But the CNS involvement in Behçet's is also one of the trickier manifestations. So, I don't know, it's interesting. I guess we'll see where research leads us in hopefully the near future, right? And like I said, I have no idea what's going on with my veins right now. So we'll see.